All right, everybody, back to our next part. So we're going to talk about kidney health. We had talked about the liver. Now we're going to talk about the kidney. On page 19 of the book, these are the tests that we do for kidney functions. Now there's the BUN, the creatinine, sodium, potassium. Sodium and potassium, those are probably the most important ones that you need to know. Sodium is like 136 to 145, and potassium 3.5 to 5. And I always think 3.5 to 5 bananas. Don't ask me why, but that's how I remember things. So you kind of need to know what the BUN levels are. You need to know what the creatinine level is. You need to know what the sodium and the potassium, definitely the level for that. You kind of should know the calcium and magnesium. Those are some of the big ones that you need to know the lab values for. But and those are stuff that are going to come on test. I will actually ask you which one is, you'll know it's when a medication is off, it's going to be really, really off. So like, for example, potassium, if I said what drug affects what lab value, and then I will give you certain lab values. If I put like one that is really, really, really low, like if potassium is 3.5, if I put like 2.1, that's going to be the answer, that it's going to lower the potassium level. If they're in normal range, then we don't have to worry about it, but you kind of need to know those lab values. Okay, so that is dealing with the kidney functions, and those are the tests that we do when we're checking the kidney and making sure everything's okay. Okay, so when we're talking about kidneys, infant kidneys don't concentrate fluids well. They have more total body water than children and infants do. So drugs do get eliminated faster, and we see that sometimes infant doses are going to be higher than a toddler or child's dose because of this. If water-soluble meds, then these meds are going to be quickly eliminated in the infant, a little less in the toddler, a little less in the child, and of course, less eliminated as an adult. Adults over the age of 60 have decreased kidney size and function. This decreases the elimination of the drug. This will prevent the drug to remain in the system longer, which will lead to drug toxicity, which will increase the risk for those side effects and adverse effects of the drug. So the majority of the time, we will see in the older adult that the doses will be lower in the elderly population. So that is kidney health. So remember, liver and kidneys, we got to watch. Now, when we're dealing with cardiopulmonary health, these are going to be lab values that are going to be on page 20. Okay, so let's look at those. Let me flip the page. All right, so page 20. You definitely need to know what the red blood cells are. You definitely need to know what white blood cells. White blood cells, 5,000 to 10,000. Those are most important. And you can kind of the hemocretin, hemoglobin. Those are the big ones that you need to know for these ones at this moment. But know that all these ones are going to be working with the cardiopulmonary, function test. So those are the ones that you need to know the lab values for. So cardiopulmonary health, white blood cells are the site of drug metabolism, The older population, if you're greater than 70 years old, you have some heart failure, which will lead to decreased blood flow, which can interfere with drug distribution, metabolism, and in elimination. So cardiopulmonary health is very important for our pharmaceutical meds. Lung function also decreases as you age. And if you have problems with inhaled meds, like you can't inhale the med appropriately, then you're not getting the med appropriately. And of course, if you decrease red blood cells and white blood cells, this will affect the organs as well as the metabolism. So cardiopulmonary health is very important. Next thing we're going to talk about is pregnancy. Pregnancy, definitely, I'm not a big thing with the pregnancy thing because you are going to have, of course, a whole, class on it. But I always say when it comes to the pregnancy, when in doubt, discuss it with your OBGYN. So discuss with the healthcare provider before anything that you're going to deal with if you're going to, if you're pregnant or planning to become pregnant. No prescriptions or over-the-counter drugs should be taken during pregnancy unless the benefits outweigh the risk. Okay. Anything that we say when it deals with pregnancy, if it's a teratogenic or teratogen, those are drugs that can cause birth defects. These are the medications that you have to use two reliable forms of birth control when you're on some of these medications. And when I say two reliable forms, I mean, condoms, certain birth control, things like that. I'm not talking about the pull-out method. That's not one of them. But you need to have two reliable forms of contraceptives. Another thing, if it's a teratogenic medication, very important to make sure that you are not pregnant before taking the medication because it can cause issues. And like I said, we do not want to cause big time birth defects and also fetal demise. So anything that is terogenic or teratogen, that is very dangerous and you need to use two reliable forms of contraceptives, but you definitely have to be tested first to make sure that the female population is not pregnant. Now, drugs that affects on the mom can also affect the fetus. For example, warfarin, which is Coumadin, actually decreases blood clotting, which in return, the fetus can actually bleed to death. So it's not a good idea to be on warfarin when you're pregnant, okay? But sometimes you can't help that. Also with blood pressure medications, we know that blood pressure medications will decrease the blood pressure in mom, and it will also decrease it in the fetus, which will decrease the fetus's blood pressure. If we decrease the blood pressure in the fetus, that will decrease oxygenation to the brain, which can cause brain damage. That's why when it comes to the pregnancy population, we used to have categories like A, B, C, and D, etc., that told you if it was safe or not to give during pregnancy, which was a really, really pain for a lot of people. Now it is written in three categories: one for pregnancy, two for lactation, three for female and male reproductive potential. But you're going to learn that more when we go into labor and delivery chapters and working with the pregnant population. It's another thing that's important to do before we give any medication, and that is we should ask women at the age of 10 to 60 if they're pregnant or going to become pregnant, or if they're breastfeeding before we administer any new medication. And it's sad that we have to ask that, but it's true. From the age of 10 to 60, we must ask that. Okay, so lactation, which is breastfeeding. I don't like the word lactation. I like breastfeeding better. So you'll hear me say breastfeeding before lactation. These are drugs that can be passed to the infant when breastfeeding. The effects of the drugs on the mother, you can have the same effects on the infant. For example, quinolone, which is an antibiotic, it can actually cause problems with bone development in the fetus. Breastfeeding is not recommended for mothers on chronic disorder drugs. For example, seizure medication, hypertensive medication, high cholesterol, hypercholesterolemia med drugs. These are ones that we do not recommend breastfeeding because it can do immensely a lot of harm to the baby. And we're going to learn about that as we go through those chapters. If they're on meds for a short period of time, there are other options that they can do until they're off the medications. And on page 22, box 1.1 gives you some ideas like expressing the milk beforehand when it's at the lowest level, things like that. So you can read up on that. Now, females and males with reproductive potential, some drugs can decrease fertility temporarily or permanently, and some drugs can actually increase fertility. So those are some things that we have to watch for. But I always say, whenever in doubt, talk to the OBGYN about certain medications, talk to the pediatrician in regards to breastfeeding and that. So those are some things that we need to discuss with our physicians if we have concerns. And last but not least for this chapter is drug interactions. Drugs can interact with anything you put in your body. It can increase, it can decrease the drug action, it can lead to adverse effects. So you need to ask patients if they're taking any over-the-counter or herbal meds. And that is very important, and that would be on page 22, some examples. So let me flip to page 22. And then, of course, those are some examples of some medications, what they can, work with other drugs that you have to be very cautious with. So it's very important this is a part of the meats and potatoes of pharmacology. Now, the next part we're going to be doing, which I'm going to record on for part two, we're going to be discussing more stuff. And a lot of it you're going to learn in lab. But like I said, when it comes to the test purpose, you do need to know the basic biology. I'm not going to test you on the basic biology parts, but you kind of need to know that because that's what's going to help with your testing. But when it comes to things that are dealing with the drugs, like the peaks and troughs, half-life, kidney, the liver, those are some things that you need to deal with. Those, paradoxical effects that kids have and things like that. But any questions on chapter one, you know how to get a hold of me.